How did you come from North Dakota to come to Dartmouth and to Dartmouth Medical School?
My father was class of 29 at Dartmouth, and it's interesting to speculate that that he would be over 100 years old now. When he was a senior, Paul Zamsnick was a freshman.
Wow.
So, but anyway, it's a family thing, and my brother went. I have an uncle that went, and so on and so forth. So, I guess a more important question: how did we get from New Hampshire to North Dakota? Well, it was because of the Depression, basically, and lack of jobs and a family connection. That's where my mother grew up.
That's good. When did you decide that medicine was going to be your career?
I think partway through college, really. Like half the class, I took a chemzo major, like Paul did. And as it went along, I decided, well, you know, this is what I really enjoy, and I did apply to the medical school and was happy to get in. And in fact, I hated to leave Hanover after those 5 years, 3 in the college and 2 in the medical school.
When did you first meet Dr. Syvertsen?
Well, I'm sure it was during my freshman year because, you know, he and Harry Savage had a practice of trying to meet all the pre-medical students at some point, and obviously to sort of get a fix on who they would like to have as their students. And none of us knew that at the time, but Dartmouth was in competition with other schools all over the country, and in fact, it turns out that 24 of us in the class got into the medical school, and yet there were 40 others in the class that went to other medical schools. And the same thing was true of classes on either side of us, so that there was that competition, and I think they wanted to get their foot in the door and to try to get the best students they could. And as a matter of fact, when I told Harry Savage that I was going to go somewhere else for an interview, he tried to discourage me from doing that. But I was happy to end up at Dartmouth. Mm-hmm.
What was Dr. Syvertsen like in the classroom? How would you describe him as a teacher and a professor?
Well, he was, it's sort of interesting to follow up on Paul's interview, who knew him as the secretary of the medical school and as a pre-MD, who was just sort of, you know, teaching anatomy to students that were probably not much older than he was, or not much younger than he was. But he evolved into a charismatic teacher who knew how to be friendly and yet stay apart. He was aloof up to a point, but he could certainly get involved with the students, especially when they needed to be involved with his oversight, really.
Talk a little bit more about his relationship with students outside the class.
Well, that was legendary. You've heard a lot of the stories that have come across at the Syvertsen Scholar Dinner.
We'd like you to tell some of those today.
Yeah. And so he seemed to know everything about all the students all the time. And I remember reading one from Alden Carpenter for, I think, class of 50. Well, I'm not sure of his class, but he was practically alone when he was a student at Dartmouth because his father had died and his mother and sister had moved away somewhere. And here he was living alone at the Episcopal Rectory in Hanover. And Cy was in and out of the rectory as a devout Episcopalian quite often, and he really took him under his wing. And one of the stories he tells is that he went to Cy one time and he said, I don't know if I can get through this course on biostatistics. I just don't get it. And Sy said, neither do I. And that was the end of it. And that's the approach he took in another similar example was when one of my classmates was caught mimicking one of the teachers that Paul mentioned, except they had a different nickname. In fact, a couple of our teachers had different nicknames as the years went on. But anyway, Snuffy Atkins was quite a character. And my classmate was caught mimicking him. And he had him come in for a special examination on Saturday afternoon. And of course, he threw bacteriology at him that none of us had ever heard of before. And of course, he flunked. And so he came from a medical family. His father was a surgeon, his mother was a nurse, and he had to go home on Christmas vacation facing the fact that he was being thrown out of medical school. Sometime during that vacation, he got a phone call from Sy telling him to forget about it and come back to school. So that's the sort of involvement that Sy had with many of his students.
That sounds like it was sort of expectations after the fact. What were examples of how he gave you a sense of what he expected of you as students and as men of character?
Well, he projected great authority and discipline. You were not allowed to have facial hair. I had to shave off my beard when I came back from a mountain climbing expedition just before my first year in medical school. He exuded charisma, authority, knowledge, and yet he could clearly be fun and be an interesting guy to be around. But he kept his distance.
Kept his distance. All right. You went to Cornell to finish up your medical training.
Yeah.
How was that decision made? Did Dr. Syvertsen have any part in that decision?
No, not really. I don't think he tried to influence people to go to any particular school. But I decided I'd been with the same guys for 5 years, and I thought New York as a bigger place would have, more sick people to, provide a good medical education. But so I'm not sad that I did it, but I'm sure I would have been just as happy with most of my classmates at Harvard. But I want you to ask me about his influence over certain people that he sensed should go or not go to a certain place.
How did he do that?
Well, it's sort of legendary that in our 2-year school that you automatically got into another school, usually Harvard, and no problem. That wasn't always the case. One of my classmates took an interview down at Harvard, which was routine, and he was denied admission to Harvard. When Sy found out about this, he was furious. He was on the phone. He arranged a second interview. And my friend and colleague went down, had a second interview, passed with flying colors. And that year, that first year at Harvard, third year of medical school, he worked so hard and did so well that he was elected AOA out of a Dartmouth background. And he wanted to make sure that Sy knew about that as a mark of his influence. And another one that comes to mind was a fellow, speaking of Cornell, was a fellow at the bottom of his class who was denied admission to Cornell. Again, Sy was furious, called the dean of admissions, and told him that this was a good man and they better take him. So they did. Well, his subsequent career in surgery was very notable. He devised new operations. He later went into academic medicine. He became dean of a medical school in Arizona. He became an assistant secretary of education or Health and Human Services, I guess we call it now. And much to his own satisfaction, he was given an award as a distinguished alumnus of Cornell University. So that's the sort of insight Cy had and would back it up.
That's true.
And the last example would be a fellow at the top of his class that wanted to go to Harvard. And Cy said he wouldn't recommend him. And he told that to Harvard, that this is not a man you want. And of course he was devastated. He didn't know why. It so turns out that he went into an academic life. He became a scientist. He realized that Cy had made the right decision, although he never said why. But he knew that this guy was not destined for anything to do with people.
Did he tell the student at the time?
I don't know. I never heard that, but I did get a letter from this man that said eventually he became aware of the fact that Cy did the right thing by him and by the people he didn't have to treat.
I brought along a letter. I brought along 2 letters, and I've highlighted 2 spots in it. One first is a letter that you wrote to Dr. Syvertsen, and then his response. So would you mind reading the highlighted portion?
Well, this is some out of the past without any...
What year is it?
Well, this is December 27th, 1954. Halfway through the senior year, the second year of medical school. As you already know, according to Dr. Handel, I've been accepted at Cornell. The letter came on the morning of the 24th, so it turned out to be a very pleasant and welcome Christmas present. I thought I'd just express my thanks for what you must have done for me down there. I see no other explanation except maybe certain idiosyncrasies on the part of their admission system. At any rate, I'm glad to be included. The more I see of the place, brief though the last visit was, the more I'm convinced it's a good spot to spend the next couple of years. Well, that's, I don't know, where in heaven's name you found this?
Did some detective work.
And the other part you've highlighted is, you probably think that at times that medical students are something of a headache when it comes to yearly business of transferring, and that is undoubtedly true. Also, you may think at times that they are an especially ungrateful lot, but on this I would like to stuff in a word. We all realize the pain and strain you go through on getting everyone placed, and I think most of us are pretty grateful for the results you get. I can say for sure that I am. Bring a tear to my eye.
So how did Dr. Sy respond to you, that part I highlighted on the back?
Well, Dear John, thank you very much for your kind note of 27th December telling me the story about your good fortune at Cornell. I suppose that sometimes certain medical students get categorized in my mind as headaches. But even so, headaches are what I live for. So don't worry about my pain and strain. If you don't cut that out, well, shame on you. You should have given me a little warning.
Oh. He really cared about his students, obviously. What do you think he saw in John Moran and in his classmates that motivated him to be the mentor that he was?
I'm sorry to interrupt. Could maybe take your
Oh, sure. Yeah. Well, I think he just wanted to get people of decent character and intelligence that would make good doctors. And, you know, I think that one of the most important things that he taught, and taught by example, was that you have to be compassionate, you have to know your patients, you have to talk to them, you have to do more than laboratory tests, but you have to get involved and stay involved and be compassionate. So I think that he was, obviously a student of human nature and was trying to do the best he could by the profession of medicine.
You stayed in fairly close contact with Dr. Syvertsen. I found a number of letters like that in your file even after you left Dartmouth. When was the last time that you corresponded with him?
Boy, if I had Dr. Zamsnik's memory, I could probably tell you and remember what I wrote, but I don't have that kind of memory. But we would see him from time to time, and I'm just sorry he died so young, relatively, in 1960 with an automobile accident, and was legendary. He was a terrible driver, and that may have been his downfall. But I don't have a clear memory of many other contacts.
Tell us a little bit about the start of the Syvertsen Scholarship Program. When did you get involved in that, and why?
Well, the Syvertsen Fund was started by two guys that were fairly senior from the class of 1940-something, 46 or so, and you know very well who they are.
Fletcher McDowell.
Fletcher McDowell and Jim Andrews, I believe.
Right.
And the two of them started it off, and I don't remember, well, it was actually about 25 years ago. I think you told that to me a while back. I didn't realize that time had slipped by so quickly. But I got involved, fairly early on, but it's been one of the fun things about staying connected with Dartmouth Medical School is the Syvertsen Fellowship.
Why did you think it was important to create a program like this at Dartmouth? Why does it matter that there's a Syvertsen Scholars and Fellows program there?
Well, I think it goes back to what he looked for in his students. He just wanted achievement, intelligence, scholarship, a compassion, and the human touch. And the students that have become the scholars are not always at the top of the class. They're not automatically, the most, the students with the highest grades, but students that have demonstrated a broad range of interests, compassion, and as well as achievement in a number of areas, which I think Dan has demonstrated.
When you look at the students that are coming through today, what do you think is most important for them to take away from being given the fellows or the scholars designation? What do you want them to remember about being a Syvertsen Scholar or Fellow? What do you want Dan to remember?
Well, I want them to remember, if they go into clinical medicine, and most of them will, to listen to their patients, to do a thorough physical examination, to take the laboratory findings into consideration, but not to the exclusion of taking a good history and knowing the patient. There are just so many examples of technology gone awry and common sense saving the day. So preservation of common sense goes a long way.
What would Dr. Syvertsen think about having a program in his honor?
I think he'd be proud. He probably would be embarrassed and walk away if you started to talk about it. But I think he'd be proud. Who wouldn't be, really, for such a worthy cause? And thanks to Fletcher and Jim Andrews, the fund has grown tremendously and will continue to grow, assuming we avoid another depression.
Let's hope so. Questions?
More stories.
That's what I was going to say.
More stories?
More stories.
Well, I really should, you know, in the vein of character analysis, another story would be a friend who became my roommate at Cornell when we were both down at Cornell, and he had not received any information about being admitted to medical school when he knew that all the admissions had been sent out, and he wanted to talk to Dr. Syvertsen to see what he did wrong and so on. And so he went up, I've forgotten what time of day, probably around noon or so, to see Dr. Syvertsen, and he was told by the secretary to wait down at the bottom of the stairs. And he waited and waited and waited, and it was apparent Dr. Syvertsen didn't want to talk to him. And the secretary, at the end of the day, had to leave, so she went down the stairs, and Bert was still waiting there for Dr. Syvertsen, and finally he came out and said, "All right, come on up." And so Bert went up and he talked to Dr. Syvertsen for some time, and he got admitted. He has gone on for a very distinguished medical career, head of neurosurgery at the Mayo Clinic, and is still active and still teaching. So again, you know, Cy could analyze who would be a good doc, and he, when we were at Cornell, one of the most popular electives was to construct the human brain and out of plastic materials and components, and to know all about it. And many of us started, but I think he was the only one that ever finished it. And he had that kind of perseverance, and that's what carried him through a very successful career. And there are other stories like that. So he had an intuitive approach, which I think paid off in many ways.
Seems as though he was everywhere all the time, all over your thought.
Yeah, that's true. And you remember Art Natov's stories about arriving back in Hanover in the middle of the night and Cy knowing it.
Had a place for him already to stay.
Right. Yeah.
That's good. Tell me a little bit more about your career, John. How did you decide to go into surgery, and why cardiothoracic surgery?
Well, I decided that, you know, as an active person, I really wanted to be active with my hands. I enjoyed, you know, all kinds of crafts and woodwork and so on, and I thought that I ought to carry it into medicine. And I really enjoyed the research side, and that's why I went along with an academic bent. And I was also seemed to be attracted to the most difficult problems, which in the beginning were blood vessels, and then esophageal diseases, lung cancer. And then when cardiac surgery came in, I was witness to some of the beginnings of valve surgery with Dwight Harkin at the Mount Auburn Hospital from rotation on my tough service at the Boston City, and when coronary surgery came in, I was able to get started in that in the late 60s, and it went on from there. So I seem to be attracted to the leading edge, so to speak, the cutting edge of surgery.
When Dr. Paul was here, and he was talking about burying their friends, and I asked about the 8x8 Society. You tell me about the 8x8 Society. So you were a member of that?
Oh yeah, yeah.
How did that happen?
I don't know. So I just said, you do this, you do this, you do this. Like one other story is how he influenced. Before I get to that, one thing I should say is that he somehow decided that I should be the ship's doctor and the ship's chemist on a research vessel out of Hanover, owned by Beanie Nutt, who was in the geography department. And this research vessel was equipped with all sorts of interesting stuff, including leading scientists from all over the world. And he somehow decided that I should be on that voyage in the summer of 1954. And I said, well, gee, Dr. Syvertsen, I've already got a job back in the state hospital in North Dakota, and I really can't renege on that. And besides that, it sounds like it's, you know, I don't know, it sounds like I really ought to have a real job instead of that. And before I knew it, I was signed up, and I still can't quite remember why, but Cy had that way about him of bringing you around to his point of view. And it was the most wonderful summer I've ever had. 10 weeks aboard this schooner with some fascinating people, some of whom I stayed in contact with through the years. And one project led to the geologic dating of carbon-14 in the ice cap of Greenland, which came directly out of that summer. As one project.